Hi, my name is Roman Bronfenbrenner. I'm a dermatologist in private practice. I'm also involved in academics at the University of Pennsylvania. I started my practice in 2021 in kind of a difficult climate. COVID was still supposedly ending because we had vaccines, but really it was just beginning. And I was very interested in this survey of other independent practitioners, mainly that Clarity did. And it's nice to see that I'm not the only one, kind of feeling like we're pedaling uphill some days. No, unfortunately, not at all. I mean, what exit strategies are we really left with nowadays? In the past, you would find maybe a partner or someone that wanted to join your practice that would be interested in taking it on. It seems like that is less and less these days, but some people are able to find that. Closing is something that most people don't want to do, where they just say, all right, I'll just close my practice and move out. Most people want to have a continuation of care for their patients, and most people want to get some sort of value for a practice that they built over 20 or 30 years. And so I'm not surprised because private equity has probably been the biggest buyer of dermatology practices. Um, but the downside is there's issues with private equity kind of oversight and or private equity backed practices compared to staying as an independent provider. I think the biggest advice is use your colleagues. There's in the community that you're in, there might not be a lot of other independent providers that you can be talking to, but online there's a bunch. And if you could connect with people who are in private practice and succeeding that are all over the country that might have had experiences that you're now struggling with and you don't know the right answer to, search social media. There's a lot of resources available there. There's a lot of people that have had similar questions to what you might be having right now. And a lot of times you just use the search function on one of the like Facebook groups that are dermatology specific, and you'll find someone that's asked the question before. And having this sort of network of people is great that you can quickly shoot a question to. Like I remember when I first opened, I got a bunch of these quotes for cleaning people, and the quotes ranged in price from $700 a month to $5,000 a month. And some of the really expensive ones were talking about how they're healthcare specific and they do this special wipe down and they have like a COVID filter that they put in. And you don't know if you don't know and you start thinking like, man, yeah, they're healthcare specific. I should probably go with them. Well, healthcare specific is another name for doctors are stupid with their money and they'll probably buy something that says healthcare specific on it. And I just there were so many places where I was like, should I be spending money on this? And I would talk to my friends and say like, hey, what do you guys do? Do you need this? Do you, empty the sharps this often? Or what should you do for that? And there's a bunch of tips that you'll get so that you make sure that, you're running as efficiently as possible. And so I went with the quote that was $700 and they've been great ever since due to, the insistence of some of my friends and after talking it through. You're not in it alone. I think that is the hardest. If you're solo and completely by yourself, and so now you don't have someone to run tough cases by, well, now you do. You could go online, you'll find a community of people that's always kind of willing to help because they know that you're in a similar boat to what they're in. And as the old saying go, the rising tide lifts all ships. So if you can help those that are doing something similar, then little by little, maybe independent practice will become less of a, like a formidable task to start.